Hi everyone, in the series of COQP22, CUETPG, Hospital Administration and Healthcare Management entrance exam. For 2025, we'll be covering this session for quick revision. We have already covered previous topics in previous videos. You can check on our channel. Go and watch them. For today's session, we are covering engineering services in hospital, and we'll be covering supportive services in hospital starting from CCD, CSSD, pharmacy, linen, laundry, food and beverages, dietary service in hospitals, heating, ventilation, air conditioning, civil engineering, electrical engineering, and water supply in hospitals. So let's start with supportive services in hospital. Sportive services play a crucial role in ensuring smooth hospital operations and enhancing patient care. These services function in the background, but are essential for maintaining hygiene, medication supply, patient nutrition, and overall hospital efficiency. CSSD is Central Sterile Services Department. CSSD is responsible for the sterilization of medical instruments and supplies to prevent infection. Functions of CSSD: Centralized Sterile Services Department. Collection, decontamination, sterilization, and distribution of surgical instruments and medical equipments. Ensures all medical items are free from microorganisms before use. Uses steam sterilization, autoclave, ethylene oxide gas, and chemical disinfection for sterilization. Importance of CSSD is prevents hospital acquired infections, HAIs, ensures safety and hygiene in surgical and medical procedures. Next is pharmacy services. The hospital pharmacy ensures the availability of medicines and provide essential pharmaceutical care. It functions by dispensing medication to inpatient and outpatient departments, managing drug inventory and ensuring proper storage, provide drug information to doctors, nurses, and patients, monitor adverse drug reactions, ADR, and patient medication safety. Types of pharmacy in hospitals are inpatient pharmacy that supplies medicine for admitted patients, outpatient pharmacy that dispenses medicine for non-admitted patients, clinical pharmacy work with doctor to ensure appropriate medication use. Importance of pharmacy in hospital. It ensures timely availability of essential drugs, prevents medication errors, supply support infection control, and rational drug use. Linen and laundry services. Linen and laundry services maintain the cleanliness in hospital bed sheets, uniform towels, and surgical traps. Functions of linen and laundry services: collection, cleaning, disinfection, and distribution of linens, separation of infectious and non-infectious linen, use of hot water washes, disinfectants, and steam pressings to maintain hygiene. Types of linen in hospitals: general linen, bedsheet, pillow covers, curtains, blankets; surgical linen, OT clothes, drapes, and sterile covers; personal linen, staff uniform and patient clothing. Importance: prevents the spread of infection, ensure comfort and hygiene for patients and staff. Food and beverages services. The hospital kitchen provide food and beverages services tailored to patient dietary need. It functions by preparing of a nutritious and hygienic meal for patient, customization of diet based on medical condition, example diabetes, liquid diet, renal diet, and all. Coordination with the dietitian to ensure proper patient nutrition. Its importance includes support the patient recovery through balanced nutrition, reduce malnutrition related complications, ensure food safety and hygiene. Next is dietary services in hospital. The dietary department works with doctors and nutritionists to uh, plan patient diet. Functions: evaluating nutritional need for patients, creating a specialized diet plan, slow sodium, high protein, soft diet, and so. Educating patients on healthy eating habits for disease management. Types of uh, hospital diets include regular diet, therapeutic diet, internal nutrition. Balanced meal for general patient is regular diet. Therapeutic diet include designed specific diet, specific health condition. For example, low sodium for hypertension. Internal nutrition include liquid diet given through feeding tubes or critically ill patients. It's important. Importance include help manage chronic disease like diabetes and kidney disease, speed up healing and recovery, prevents malnutrition and complication in hospitalized patients. Next, we'll start with engineering services in hospital. So, hospital require engineering services to ensure proper infrastructure, environmental control, and utility management. These services contribute to patient safety, infection control, and overall operational efficiency. So, first is heating, ventilation, and air conditioning in hospitals. HVAC. HVAC systems are critical in maintaining air quality, temperature, and humidity within hospital premises. Functions its function include provide proper ventilation to maintain fresh air. It control temperature and humidity for patient comfort and infection prevention. It reduces airborne infection in operation theater and IUCs, intensive care units, and isolation wards. Ensure positive and negative pressure area to control contamination. Its importance include prevents hospital acquired infections, maintain optimal condition for surgeries and patient recovery, protect sensitive medical equipment from moisture damage. Then we have civil engineering services in hospital. Civil engineering ensure hospital infrastructure maintenance and structural safety. It functions by construction and maintenance of hospital building. Its main function include designing hospital layout for efficiency, patient flow, emergency exit, and waiting area, waterproofing and flooring to prevent microbial growth. Barrier-free design for accessibility, ramps, elevators, disabled-friendly toilets. Its importance include ensures durability and safety of hospital infrastructure, supports infection control through proper material selection, enables smooth patient and staff movement within the hospital. Then we have electrical services in hospitals. Electrical services ensure uninterrupted power supply to critical hospital equipment and facilities. Functions including powering IUCs, OTs, diagnostic labs, and medical equipments, MRI, CT scan, ventilators, ensuring backup power through generators and UPS, lightning and signaling systems, electric safety. Its importance include life-threatening situation due to power failure. It prevents those situations. It also ensures proper functioning and life-saving equipments. It provides a safety to working environment, safe working environment for staff and patient. Next is water supply and plumbing in hospitals. Water supply ensures clean and safe water for various hospital operations. Functions of water supply and plumbing system in hospital include providing potable drinking water for patient and staff, ensuring sterile water for surgeries, dialysis, and medical procedures, wastewater treatment and disinfection for contaminated water, plumbing of restrooms, patient ward, kitchen, and laundries. So all those things will be cared by plumbing and water supply department. Its importance include preventing waterborne diseases, waterborne infection, ensure adequate sanitation and hygiene, support various medical and operational functions. So engineering services also are very important. We call it HVAC, uh, civil engineering, electrical, water supply, or all essential for a hospital. So thank you for watching this video. If you have any query, put down in the comment section, hit the like button. Wishing you good luck for your exam. Thank you.